As most of you guys will know, I am a cardiac nurse. I am in my grad year, which basically just means that I graduated last year and this is my first year working as a registered nurse. Because of that, I get a lot of questions from you guys about nursing, so I figured it was finally time to put everything into one big video so that I can answer some of the questions that I get on the reg from you all about nursing, because it is a huge part of my life, and I released an ebook about it at the start of this year, and since then people just come to me all the time with their nursing questions and queries and things like that. So yeah, that's this video. Just wait for the wind. Sorry if you can hear the wind. I had to get out of the house because of the babies. Yeah, it just wasn't happening filming at home because they just want to play with Auntie all the time, which is super cute but super annoying when I'm trying to film. So hopefully you can't hear the wind. This video is perfect for anyone who's ever thought about doing nursing, any nursing students, or anyone going into their placements or grad year or anything like that. Even if you have no idea what you want to do in life and you're literally just looking to find out some information about any sort of career, I will tell you all about nursing, the truth. The good, the bad, the ugly, the gross, the fun things, literally everything. I've broken this video into 5 different subcategories, and once I've gone through all 5, by the end of this video you'll have a whole idea of what it really is like to be a nurse. So without further ado, let's get into it. Being a student and going on placement is by far the scariest thing ever. Like, it's just, if you're a student nurse and you have, or even haven't been on placement yet, you will know the fear that I'm talking about. It is so scary thinking about going into a hospital and literally looking after people's lives every day, especially when you don't really know what you're doing. So placements can definitely be a very stressful time for a nurse. My biggest tips for placement would definitely be keen and show it. Like, ask a lot of questions. No one is ever going to look at you silly for asking questions. If anything, they're going to look at you silly if you don't ask questions, because there is nothing worse than a student who either already thinks they know everything or can't push past that boundary to even find out what they don't know, if that makes sense. So yeah, definitely look keen. Obviously little things like being well presented and all those things, but they're just like normal human things. Do your study, but don't overwhelm yourself. If there's something that you don't understand at uni, or even something that you don't understand at placement, do a little bit of research, ask around, try and learn in different ways. So like, don't just listen to lectures, like look on YouTube or like pictures, like whatever, to work out how best that you learn, and then apply that on placement and really try and understand things as much as you can on placement, because it's the best time that you will have to learn. Massive no-nos: don't ever come off lazy, don't ever come off like you already know what you're doing or like you don't want to be there, because those things speak so loudly. And there are a lot of good students out there and there are a lot of bad students out there, and I guess it is really important to make sure that you're not coming off as like unmotivated or lazy or disinterested or anything like that. So that's like the main don'ts. And one question that I got on Instagram was regarding like dealing with like old mean nurses, like when you're buddied up with them. So basically when you go on placement, it's usually like in the first couple of the first year it's like 1 or 2 week placement, second year it's like 2 to 3 weeks, and then from there they're usually 4 to 5 weeks, or just chunks of working on the wards and not getting paid any money, which is stressful. But you will, I can guarantee you will have a placement where you are with someone who just acts like you're the biggest hindrance of their life, that they don't want to have a student, that students are a burden or whatever. Most of the time everyone is so lovely and they're so helpful, and like we love students. Like I've even had a student as a grad and I loved it. Like every second I was like, let's learn something new. So like most people are like that, but you will get like the old mean nurses that just, they don't give a damn, they don't really care enough about their job to try and help a learning, flourishing little student nurse like yourself to learn. So my best tip for that, if you do have one of those preceptors or buddies that just isn't quite up to your standards, if they're really bad, flag it with management. I did that on one of my placements where I had this buddy who was just, she just wasn't nice, and she just thought I was the dumbest thing in the world, and it really, really upset me because I know that I'm not stupid, and her expectations were just like for the level that so I think I was like first semester of second year, and like she was like expecting me to be like grad level, and I was like, what the hell? So I spoke to management about that, because I was like, I'm not getting anything out of this placement. Oh, sorry. Like I'm not getting out of my placement what I feel like I should be getting, so they swapped me. But if it's not that bad, or if you are not with that person every day, just take it with a grain of salt, still do the best that you can, still show up 100%, and just know that they obviously hate their life. Or they obviously hate their job or whatever, and it's not on you, it's just them. So just try not to let it get to you. Obviously one of the main parts of being on placements and being a student as well is eventually you will have to apply for and hopefully get a grad year. I don't know if I should do a separate video on that. Maybe leave me a comment if you think that I should, like on the actual grad year application process and all of those things. But in the meantime, I actually made an ebook on it at the start of the year. Shameless plug. So if you do have any questions or you're coming up to, actually no, I think they've already been for this year. Yeah, any grad kind of applications, especially like if you're second year or third year, 100% get my ebook. It's super affordable. It literally answers every question about grad years. I've got like interview questions taken from actual interviews, like do's, don'ts, what to wear, what not to wear, literally everything has been covered. So if you want to buy that, just it's on my website. But anyway, no more shameless plugs. Let's talk about shift work.
All nurses to the nurses station.
So just about everyone talks about shift work like it is the pits, like it's the worst possible way of working that there ever was invented in terms of ways of working. But I disagree. I like shift work. I think that there is pros and cons to every kind of job, and I personally love that shift work is a variety. So instead of you constantly, it's like Monday to Friday, 9 to 5, you do the same thing, same time, you get a variety with shift work. It's amazing. To give you an insight into the exact shift work that I am talking about, my hospital, and I think most hospitals in Victoria, the way they do it is, so there's the AM shift, 7:30 AM to 3:30 PM. The PM shift, which is 1 PM to 9:30 PM, and then there's night shift, which is 9 PM to 7:30 AM. Obviously night shift is not the greatest thing ever. It's challenging, testing, stressful, you turn into a hermit, but we'll talk about that in a sec. But actual shift work, I think it's great because if you do the AM shift, you have time in the afternoon to do whatever you want. If you do the PM shift, you have time in the morning, and because your shifts change all the time, you just have more of a variety. And you know, you get to go to the shops when not everyone's around, which is amazing. You don't really have to deal with peak hour traffic. I really like it. And even with night shift, well, different people deal with night shift differently. I don't mind it because I sleep really well during the day. So when I'm on nights, which is every 6 weeks, we do like a 2-week block of nights. So over 2 weeks, I think we do like 7 night shifts. And the way that I do it is I just commit to, in the chunks that I have night shifts, in those chunks, I just commit to doing night shift and that's it. I don't put the pressure on myself to still try and go and socialize and still try and go to the gym and still try and do all these extracurricular things, because I feel like that's what puts so much more stress on your body when it's already like, what the hell's going on? Why am I sleeping when the sun's up? And why am I awake overnight and having dinner at like 2 AM? You feel me? And I'm sad to say, but your first couple of nights are probably going to be horrible because you don't know how to do them yet, but it's through trial and error that you work it out. For example, on a couple of my night shifts, I didn't sleep, like I didn't have a nap at work, and then some I did, but it was through doing that I realized that it's probably easier just not to have a nap. But some people, like, they need to have that sleep, or like, you know, I guess it's just through trial and error that you work it out. And I'm sorry that's not really helpful because you're probably like, well, I don't want to have the error side of things, but that's how you'll learn, because my body is completely different to your body and the way that you function, so you're gonna have to work it out on your own. Another thing with night shift, I had a question on Instagram that was basically just saying like, how does the shift actually work? And I think this is a great question because that was the thing that I was the most nervous about, because like with AMs and PMs, like everything kind of happens like kind of routinely. Like most people have meds due at like 8 AM, 12 lunchtime, 6 PM and 8 PM. So you kind of already know that those things are coming, and then you might have like a wound dressing or like to go to a surgery or something like that. Night shift, so basically I'll just give you a quick rundown of how my shift, like typical shift would work, which is never a typical shift because my ward's crazy. So come on at 9, wait, sorry, I have a hair stuck to my eyelash. So come on at 9 p.m, get handover, which usually takes until like 9:30, 9:45. I then quickly race through and do just one set of obs on everyone, because I just get a bit paranoid and I just like to know, even if they've just had obs done, I just like to know for myself, because accountability and our registration, and I don't ever want to be like, oh, but blah, blah, blah said they were fine when I didn't check myself. In terms of things being due, they'll either usually be due at 10 p.m, midnight, 2 a.m, every now and then you'll get something due at 4 a.m, and then 6 a.m, like Panadol and everything. So you're usually busy up until about 1:30 or 2, and then you've got time to write notes, nothing really happens. And then on my ward, because we're a cardiothoracic ward, everyone needs to be weighed and have a daily ECG done, so that happens between like 5 and 6, and then you just wait for the next staff to come on. So I want to give you a bit of an overview on what a typical shift will look like. As I said before, there's AMs, PMs and night shift. They are all different. Things will change like that on your ward, on your shift. Sometimes they'll be textbook, like nothing will go out of the ordinary. Everyone's meds will happen right on time, obs will happen right on time, all those things. But I guess a good tip that I have is always be prepared for things to go south. So get things done quickly. Don't look at your shift and be like, oh, I've got so much time, I'm just gonna mosey on through, because I can just about guarantee you that will be the day where you have like 3 met calls and you don't have time to do anything, and then you get out late. So just be prepared. However, in a perfect world, this is how a typical day in the life of a nurse would look. I'm just gonna stick to an AM shift. These are my favorite shift. I love them so much. So we'll just talk about that. So AM shift, 7 AM to 3:30 PM. So you come on at 7, you do what's called a huddle, which is basically all the nurses that are coming on get handover from the nurse in charge of everyone on the ward. But it's just like a really brief, like, you know, bed 1 had a bypass surgery 2 days ago, is doing fine. Bed 2 is a heart failure patient, nothing's changed. Like, it's just a really quick rundown so that everyone has an idea of who is on the ward and who to look out for. So it's a great time for the nurse in charge to flag things like really high falls risks, people that are like deteriorating. We have all of our patients are on cardiac monitors, so we have alarms. If people are alarming for something that maybe isn't accurate to actually what's going on in their body, they'll flag it then and be like, you know, bed 22 keeps alarming for VT, but it's actually not, it just, there's something wrong with leads, you know, like it just kind of gives you an idea. Then you get actual handover. So go to the bedside for each patient with the nurse from the previous shift, and you both go through like all of their current issues. Some nurses will then go through a head to toe. I think that's unnecessary, it takes way too long. All you have to do is flag the current issues for the patient, what we're doing about it, what the plan is, and then I guess looking at like discharge planning and things like that. This is a great time as well for, because you're doing it at the bedside with the patient, for the patient to ask any questions or clarify or anything like that. And it's really, really important that you do involve your patients whenever you can, and bedside handover is the perfect time to do that. I'm actually doing my grad year quality project on bedside handover, which is why I'm super passionate about it. But yeah, so you get handover. Pretty much everyone will have meds due at 8, so it's usually handover, obs, and get people's meds. Dispense meds on my ward, we do it at the bedside, so it's like another education time for the patients to go through all their tablets, because you'll always have like little old granny Elma who you give this big cup of tablets to, and she just throws them back willy-nilly, has no idea what is even in there, and we just think that that's not really right. So even though they might not understand everything that you're telling them, it's a good chance to reiterate why they're on so many tablets and those kinds of things. Then you will usually have things to do such as like showers, making beds, helping people with their breakfast. If they're diabetic, you'll be checking blood sugars at this time as well before their breakfast comes around. And then from there you usually have a few issues pop up. For example, if they're hypoglycemic, so they have a high blood sugar level, then you have to get insulin, so then there's like a task. So you kind of get like follow-on tasks as you go throughout your day. Then the ward round will happen, so the doctors will come and they'll talk to the patients, which you are involved with. I love being on the ward round, because another thing that I'm super passionate about is advocating for patients. So I will always ask my patients before the ward round happens, do you have any questions? Do you want me to ask them? Do you want to ask them? Because sometimes patients get a bit scared to talk to the doctors, or they don't want to seem silly, so they don't want to ask a question. So it's a good time for you as a nurse to advocate for your patient and ask them, like ask the doctors, or just flag some things with them that maybe the doctors have missed. Then once again from there, you will have tasks from there usually. So for example, the doctors might come and say, all right, take their ICCs out, take their catheter out, and let us know when you've done that, and then we'll go for a chest x-ray in 4 hours time. So then you've got tasks from there. Usually by the time you've done all this, it's coming up to 12 o'clock when you have more meds due, so OBS and meds again. And then 1 o'clock, the PM staff come on, you hand over bedside, as always, and then you have like a double staffing time where you do some breaks, but you can also do the difficult tasks, or the more timely tasks, or the things that involve 2 nurses, like taking ICCs out or something like that. So then you have that time, and then you go home and enjoy the sunshine, because you finish at 3:30 because shift work is the greatest. Yeah.
Code blue.
Oh. This might sound really weird, but emergencies are my favorite thing. No, okay, they're not my favorite. They're really stressful, but I do love them. I think that they're really interesting. I guess the thing that I love the most about them is I love seeing so many minds together, just taking in so much information and just like running through like the problem solving and like the process of elimination, but in such a time critical environment. Like I just think it's so interesting, and like, because like you'll get like the, you know, all the head honchos, doctors that are so experienced and so knowledge come in. I just love seeing them at work, and I love seeing, I don't know, I just love them. And the adrenaline, like the adrenaline is so good when it's just like, oh my God, they're gonna do this. And like as a nurse, you were usually the first person to be there when an emergency like a code blue or a met call happens. So for example, you could come into your patient's room and check their blood pressure. They might look a little bit off. The result comes up on the monitor and it's like blood pressure is 88 on 40, and you look at them and you're like, wow, it looks like it's 88 on 40. What am I gonna do? Met call. You're gonna call a met call. But in that time, even before you call it, you're already problem solving, you're already thinking. So like, you know, you'll look at your patient and be like, okay, are they a surgical patient? Do they have like a drain site? Have they just dumped a whole lot of blood? Are they bleeding from somewhere? Is this a big drop for them or is it not? Is their blood pressure normally 90 and now it's 88? Like that's fine. But if it's normally 140 and now it's 88, yeah, that's a problem. So you're already starting to think these things, and you're already thinking ahead like, okay, well, what are we gonna do? Well, we might give some IV fluids. If they're bleeding, we're gonna have to give them blood transfusion. If it's really bad, they're gonna have to go to ICU. So you're already starting to like think ahead, and I guess you're not putting any interventions in place because the doctors need to order a lot of things. And it's usually at the discretion and the final call of someone else, but you're still thinking these things and getting them ready. And I love that. Like I love when there's like an emergency, there's like a met call, and the doctors will come in and you're just like cool, calm and collected, like, hi, I'm Georgia, I'm the bedside nurse. This is the current situation that we have going. This is the past history of the patient. This is how they presented in the last half an hour, and this is how they are now. This is what I'm thinking, but I'd love to know what you're thinking. And they'll be like, damn, this nurse is great. I love it. Having said that, they don't always go like that. All right, let's get into some story time. So obviously I can't go into too much detail because of like confidentiality, but I have had 2 codes in my short career. Both of them weren't on my patient, but the first one was definitely the worst. And basically the reason that they were bad, sorry, my eye's watering. Well, because they weren't my patient, I didn't know anything about them. So I didn't have that element of like, I know what's going on, blah, 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 blah. It was literally like, this person just had an arrest, and it was not anything like they tell you in uni. And that was the thing that I took out of it the most, is like, yeah, it's not all like how they tell you at uni. That's all I can say. And that person ended up going down to ICU and all those things, and it wasn't a very good outcome. Sorry about my eye. Probably doesn't bother you, but it's bothering me. Yeah, and then met calls. My ward, this is one reason I love my ward. My ward has the highest amount of met calls for my whole hospital. And not like, oh, every other ward maybe has like, you know, 20 or 30 a year. Mine has like 50, 60 a month. We've had one shift, I remember, actually me and my preceptor, this was one of the last shifts we had together before she went overseas. We literally had this shift where we had back-to-back met calls for, it was like a solid 6 hours. Like my patient had a hemorrhage and his blood pressure was like 200s, and we were doing 3-minute manual blood pressures on him. And then like a few beds down, there was some other guy who had chest pain, which is pretty common on my ward, but he wasn't our patient, so we didn't know what was going on with him. But the chest pain that he was describing was like he was having a heart attack, which he was, but we didn't know that because we didn't know anything about him. We didn't know why he was there. So we were literally bouncing in between these 2 Met calls. Like it would just be like Met call, the doctors would be there and they wouldn't even leave. Or no, they would leave for like a second and then we'd just have to Met call it again and they'd come back and they're like, hey guys, and we're like, hey, you didn't do any interventions, so nothing's changed. Yeah, so, oh my bloody eye. I think like my hair got in it and like the wind is irritating it anyway. Yeah, so I really love Met calls. My tips for people who haven't had much to do with Met calls, because I'm obviously saturated in them because they happen all the time on my ward, is if you think you need to call a Met call on your patient, like don't waste time, but just make sure that you are doing the right thing. So for example, with my blood pressure example before, if their blood pressure is, it says it's 88, look at your patient. Does it look like their blood pressure is 88, or do they look fine, they're sitting talking to you, they don't feel dizzy, nothing like that? Recheck it, check it manually, do those things so you're not just like, oh, here's one piece of information and I'm going to initiate a Met call. Like, just try and use your clinical judgment. And if you're not sure and the patient is stable and they're fine and they feel fine, you can go and get another nurse and be like, hey, can I have your opinion? But if they're not stable and they're not fine, you have to stay with them and press whatever emergency buzzer you have for your ward. Some people say it's good for students and new nurses to scribe in Met calls. I've scribed quite a few times. It's not too bad, but sometimes it is hard if you don't know what's going on or you're not used to the medications that they'll most likely be giving. So it's always good if you are scribing just to grab another nurse and just be like, hey, do you mind just sort of like peering over my shoulder and just making sure I'm doing the right thing? Just a couple of times so you can get used to it. And honestly, there's nothing wrong with just standing back and observing. My first code, literally the more people that came in, the more I backed out of the room because I was like, I don't understand what's going on and I'm not going to be helpful. So I'm going to get out of the way, but still pay attention to what's going on. So I'm still learning, but I'm not in the way because there will be so many people in those rooms. Yeah. That's emergencies. I think I've covered most of it there. If you have any other questions about emergencies, put them in the comments and I can try and reply to you. Yeah, I love them. I think they're great when they turn out good. Yeah, that's probably the main part. And last, but definitely not least, is my favorite part about nursing. To understand my favorite part about nursing, you have to understand why I became a nurse. My mum was very unwell for quite some time, and obviously with that, she was in hospital. I would go and visit her, and just a couple of times there was some amazing nurses. Like, literally, they were just, like, I could never thank them enough for what they were doing for my mum and how much they were supporting us, all in such a stressful time. Because there is literally no more stressful time than when someone that you love is unwell. But then there was also the flip side of that, where there was those nurses who would just waltz on in, didn't give a damn, didn't really show any passion. They didn't care about my mum, and I just thought, why do a job like nursing if you're not gonna like bring so much love and compassion and help and health and everything to the table? So that was the thing that made me think, well, if I ever was a nurse, I would be a good one. So that's why I became a nurse, because I thought, well, that's something that I would love to do, and I would love to, I'm passionate about it, you know what I mean? So, hi doggo. Hey Popper. Great little distraction. I love you so much, doggo. Anyway, so for me, the best part about nursing is we have really long-term patients on my ward. Actually, even not the long-term patients on my ward, just the patients, getting to know them, getting to know their families, because you are involved in such an important time in their lives, and I love that. I love giving back to them, and I love supporting them. I love doing all the little things, like making the cups of tea, like getting to know them, like talking about their families, all those kinds of things. I just think that those little things and the care that you're providing to the person as a whole picture, like I just love that so much. People always say like, I love seeing my patients when they walk out the door, and like I used to always cringe when I'd hear people say that, because I was like, that's such a corny nurse thing to say, but it's so true. Like, when we have, especially on my ward, we do transplants. So when patients finally get to go home after literally almost dying and then getting through this major surgery, doing all of this rehab and all the things that come with having a transplant, and they get to go home and they have this whole new life, like that in itself is just the greatest thing ever. But I'm sure in every other area of nursing there is like that equivalent where there's one thing that just you can't even put it into words, you can't explain it to people who aren't involved in it because it's just magical. There's also this one thing that I actually really am enjoying lately on my ward. We have such good banter. Like, I know that sounds so silly, but like, nurses' humour is usually pretty dark. The things that we see and therefore the things that we joke about are probably things that most people would be like, oh my god, I can't believe that they're actually laughing about that. But we all have this just such good banter because we see things that most people will never see. So I don't know, there's such a good energy on my ward anyway, in that we're all there for the same reasons, and we all, I don't know, I think I'm just rambling, but what I'm trying to say is that I love it. And I think if you're thinking about being a nurse, or you don't know what you want to do and you're literally just looking for anything, but you have that passion to help people and you genuinely are someone who likes to help and loves to be involved and all those things, like, nursing is just the greatest. Obviously it has its cons, like, hello, we wipe people's bums, we deal with bodily fluids, we have patients that abuse us, there is bad things that happen, people die, but for me, the pros outweigh the cons, and what I have learnt in my short 9 months of being a nurse, well, plus my 3 years of being a student, I couldn't even put a dollar value on it. Like, I think it's so important, and I think it really is a great, great, great career. So if you are thinking about it, like I'm thinking about the sun in my eyeballs, you guys should do it. That didn't make any sense, but I was just trying to segue into the fact that the sun's in my eyes, and yeah, I'm gonna move position to wrap this video up. Cool. Okay, so that's all. I hope I've been able to give you a good insight into the life of a nurse, what it's really like, the good, the bad, the ugly, all those things. And yeah, like I said, if you've been thinking about doing nursing, I highly recommend looking into it. I think it's a really, really great job. It's really, really rewarding. I love it. And yeah, if you have any other questions or you want me to address anything else, just leave me a comment down below and I will try and get back to you, or I'll make another video. Maybe I should make a little series of videos about nursing. Who knows? It's a big part of my life, so you just let me know and I can answer any questions you have. Singing is not my forte. Anywho, let's just wrap this up. The wind is getting a bit excessive. I'm sorry if you've been able to hear it this whole video, but please do like, subscribe, comment, all the YouTube things, and I'm already excited to see you guys in my next video, so I'll see you there.